House lawmakers passed a revamped bill a few hours ago, changing how Indiana provides resources to Hoosiers in crisis.
Lawmakers in the Senate already passed a similar bill earlier in the session, but the reality is this work is far from over. 13 News reporter Emily Longnecker joins us live in studio tonight to explain why. Emily.
Well, Ann and Scott, lawmakers still have to figure out how they're going to fund some of the proposals in this bill. This is a budget year, meaning lawmakers are still working on how much the state is going to spend over the next 2 years and what they're going to spend it on. But many have said it's time to overhaul a mental health care system that's been in place since JFK was president. Senate Bill 1 proposes setting up a crisis hotline for people to call if they or a loved one are having a mental health issue. It also provides for a team of mental health providers to respond to a situation where someone is in crisis. The proposed law also sets up crisis stabilization units for follow-up care. The passage of Senate Bill 1 comes just as Indianapolis's FOP is calling on IMPD to stop asking its officers to respond to mental health calls. This as 2 IMPD officers face criminal charges in the death of 39-year-old Herman Whitfield III. Whitfield died after police responded to his parents' home after they called 911 for Whitfield, who was having a mental health emergency. If Senate Bill 1 becomes law, families would be able to call a separate 988 hotline to get the help of mental health professionals instead of calling police. Right now, though, as lawmakers continue to work on the state's budget, how to fund the hotline is still up in the air. Some lawmakers in the House say it should come through raising the tax on cigarettes. Others want to add a fee to your cell phone bill.
Senate Bill 1, simply put, is committing to creating a behavioral health system that is for today's world. Someone to call, someone to respond, and some place to go.
And the fact that what's occurring while we're debating this, our legislators are debating this, and they're trying to figure out from a cigarette tax, this tax, that tax. In the interim, we're dumping it in the lap of our law enforcement officers. And what we are saying as their representatives is we're done doing that.
The IMPD responded to Snyder's request for officers to stop responding to mental health calls, saying it was constantly evaluating their policies, training, and response to runs involving a mental health crisis. IMPD said it would be meeting with their public safety partners in the near future to discuss this very thing.
All right, Emily, thank you. I know you'll keep an eye on it.
For sure.